This patient was referred to me for endodontic retreatment of tooth number 3. The patient is 32 years old, and according to the patient, this root canal was done 20 years ago when she was 12 years old. And patient says that about 9 years ago, she developed a swelling above the tooth, and her dentist at the time drained the infection, the swelling, the abscess, and since then, she's been fine, and tooth has not hurt or bothered her for the past 9 years. And she just got a new dentist. Her new dentist did an examination and some x-rays, and according to the patient, the dentist saw something on her x-ray and wanted us to take a look and possibly just go ahead and redo the root canal for her. But take a look here. So that's the tooth number 3. There's a crown on the tooth. What's going on with the mesiobuccal root? It looks like it wasn't even treated. Let's take a look at another angulation. And take a look here. You can see a periapical lucency associated with the palatal root. What is this? This lucency right here. Right here. Periapical lucency and the lucency again. As you can see, the mesiobuccal root hasn't even been treated. And again, you can see that lucency there. So percussion, tender, palpation, slightly tender. Let's go ahead and probe it. Here I'm getting about 3 millimeters, and here I'm getting about 9, and I'm up to almost 12 millimeters here. And everywhere else is fine. So 12 millimeters right here. Okay, so you saw the probing at 12 millimeter pocket, as you saw. So that's why it all starts in endodontics. It all starts with proper diagnosis. If I had not probed this tooth and I had recommended redoing the root canal, went ahead and redid the root canal, all that stuff, it would not have worked. And this patient would have paid me for a root canal retreatment. Plus, she would have had to pay her dentist for a build up and a new crown, all that stuff on a tooth that is hopeless, has a hopeless prognosis. So that's why it's really important to do a thorough examination, which includes probing depths, and then properly diagnosing, and then based on the proper diagnosis, then you can treatment plan. And in this case, of course, we did not recommend endodontic retreatment. This tooth has a hopeless prognosis, so we recommended extraction, advised patient to contact her dentist to get a referral to either an oral surgeon or a periodontist for the extraction. She'll probably need a sinus lift, bone graft, and then later on she can go ahead and get a dental implant. But definitely do make sure that your examination is thorough. You owe it to your patients. Improper diagnosis leads to improper treatment. It all starts with proper diagnosis. So here it is: extraction, sinus lift, bone graft, and later on a dental implant and a crown on top of the dental implant. And we just saved this patient thousands of dollars in endodontic retreatment, build up, and a new crown. And she can put all of that now towards getting what actually works with a very good prognosis, which is a dental implant and a crown. Okay, so make sure your diagnosis is proper. Make sure, as I said, it all starts with proper diagnosis. Proper diagnosis leads to proper treatment. Improper diagnosis leads to improper treatment.